and welcome to our YouTube channel Radiance with you. I'm Sayukta, and I hope all of you are doing good. Today, we are going to
Over the counter is also not advisable, but sometimes by fluke, the pharmacist could suggest the right medication or a basic antifungal, which might work at the initial stages. But even that is not recommended.
Hmm. So the best way is to go and consult a dermat and follow the prescription. That's
Yes,
really important.
yes.
Doctor, what role does personal hygiene play in preventing fungal infections? And are there any specific hygiene practices you recommend?
Yes. So a minimum of twice a day bath would be recommended. It's not that by bathing the spores are removed, but it does keep that area clean. So it helps preventing further spread on the person's body itself. Number two, if the person has been scratching, there are pores, embedded in their nails. So by helping, by washing your hands constantly, you actually help remove the spores which are dormant, which could spread to others in the family. So these practices of, a frequent bath, keeping the area dry, and frequent changing of clothes, keeping the nails trimmed, does help in prevention of a relapse or spread to other body parts or spread to other individuals.
Right. So maintaining personal hygiene is very important, and especially during summers because we are experiencing summers in most part of India. Now, after that, we'll start experiencing monsoons, more humidity, more sweating, etc. What can we do on our own to, prevent ourselves from getting fungal infection? As you said, I mean, maintaining personal hygiene is the key. That's one of the most important things that we can do. Apart from that, can we go for antifungal dusting powders, antifungal soaps, etc., on a regular basis as a preventive measure?
Okay, so if you are an individual who's prone to fungal infections, yes, that's one of the things you do as a maintenance. Go for an antifungal powder and an antifungal soap or body wash. That would be advisable. But if you have never had a fungal infection, but there is someone who your close contact having fungal infections, it's best to get that individual treated so that it doesn't spread from that individual to you. Apart from that, just a good hygiene practice like what we discussed prior to this, that would help prevent getting an infection from the external, from the environment.
Right. Doctor, are there any dietary or lifestyle habits that can help boost the immune system and reduce the likelihood of fungal infection?
Yes. So a very well balanced diet. You will have to maintain a good exercise routine. Basically and generally, these things do help boost immunity. And if you're prone to coughs and colds and eczemas, try to get multi supplements like multivitamins, omega-3 fatty acid supplements. This would help maintain the skin's immunity and the body's immunity.
Right. So it's equally important to boost our immune system because, even if 10 people are exposed to a person who is infected with fungal infection, it's not necessary all the 10 will get the infection from him,
Yes.
that particular person. And it depends a lot on their immunity. So it's always good to work on our immune system, on our immunity.
Yes.
And doctor, what preventive measures can healthcare professionals take to minimize the risk of, nosocomial fungal infections in healthcare settings?
So, for healthcare practitioners and assistants, basically change of gloves, change of coats, hand washing would really help prevent a spread from, the medical setup to the patient. So, and the hygiene of the medical practice itself.
Right. So that is something they need to follow. Doctor, I mean, we see in a regular practice, as you also said, if you are in a family and any one of the member of the family is infected, then they need to be more careful so that the one person don't, end up transferring the fungal infection to others. So there are certain things that we can keep in mind. But when we are in a closed, non-controllable environment, for example, children going to school. Maybe they are infected with fungal infection. For example, people who are walking in or out of a gym or office or metros or bus, etc. They are commuting from bus, bus, etc. I don't know whether the person who was sitting just before me in the bus was infected or not. But then I'm prone, or maybe my immunity is not that good. What can I do to minimize my risk of catching a fungal infection?
Yeah. So the risk factors are reduced when your personal hygiene is maintained and when your immunity is maintained. So, like you said, not everyone contracts fungal infections, although we might be exposed to the spores. But the person who is more predisposed would be one who has a lower self hygiene and a lower immunity. So if you maintain these two things, the chances of you getting an infection, although you might have a colleague who has an infection or a close family member, the chances are less.
Okay. Doctor, when a person comes to you with a fungal infection or maybe any kind of infection, the person is not aware whether it's a fungal infection or anything else or some allergies. They are just, encountering itching, redness, whatever. Now, what test do you recommend for diagnosis? It's just by physical or clinical investigation you make out that it is fungal infection, or you need some test for the proper diagnosis?
So this actually depends because in initial stages, fungus is very easy to identify. They come with a special characteristic. And if you do see, it's like a spot diagnosis for a practitioner, and you can start treating immediately. But if a patient comes with a recurrent, relapsing type of an infection, the appearance may have already been modified and it could mimic an eczema or a psoriasis at times. So, in such cases, before addressing or treating the condition, generally what I prefer doing in my practice is I send a skin biopsy. I send a biopsy for examination and I get the confirmed diagnosis before treating the individual, because a mixed diagnosis or a wrong diagnosis can actually worsen the infection.
Okay. And those, because beforehand we also spoke about those who directly do not go to the doctor at the first place. They have done something, applied something on their infection, and then after maybe months or years are coming to you. In that case, does it become even more difficult for you as a doctor to diagnose whether it's fungal infection or not, or how much has it spread, etc.?
Yes, it makes it difficult to diagnose and to make a confirmed diagnosis of the investigation into a scalp infection is mandatory before you start treating accordingly, because the treatments vary. For a fungus will be antifungal, and for a boil or an alopecia areata, the treatment modality is very different.
So again, diagnosis is very
Very
important, and
important.
for that we need to go and consult the right person, the right expert, which is a dermat. We have few questions coming up from our viewers. Meenal Verma is here. How is the yeast infection diagnosed?
A yeast infection is generally you can do a swab test depending on where the yeast infection is. If it's a vaginal yeast infection, there is usually a discharge, and then
Mhm.
probably you could take a month to 2 months of permission for open shoes, which would help with the resolution of the infection with the treatment, medicated and oral and application. Now, for athletes, usually their socks, their footwear gets wet. Now, frequent changing of stockings would be highly advisable, so 2 3 pairs during their time of the event, and post that they need to get treated adequately so that it does not relapse or worsen.
Okay. We have one more question from Vishal Shah. His question is how to prevent nail fungus. Who are at risk of having nail fungus, doctor?
So those who are generally working with a lot of water, doing a lot of housework. Maybe you're a cook, you're a chef, those involved with a lot of water based work are more prone for the fungal infection. But having said that, not necessarily everyone who works in water gets fungal infection of the nail. Now, it could be that the case being that you had a fungal infection elsewhere and you started scratching, but somehow that infection got inoculated in the nail bed and you develop the fungal infection. Okay, so the two things would be, if you are working in water and you've got a fungal infection, you have to use gloves. And if you have infection elsewhere, it's better to get treated, because the scratching or the manipulation of these areas could give rise to nail fungus.
Right. We have seen a lot of fungal infection recurrence. People who have had fungal infection at the first time, they'll keep on getting it again and again. Why it's so not completing the treatment is that also one of the major reasons?
Yeah, in fact, that is the main reason. So it
Mhm.
was missed, diagnosis missed initially, mistreated initially, and did not follow the complete. They did not complete the course of the initial treatment of the fungal infection. That's
Mhm.
most. That's one of the biggest reasons why these fungal infections keep relapsing again and again.
Okay. We also have this tendency of popping up pills over the counter. I mean, we have already spoken about topical applications, but popping antifungal pills is another big craze, antibiotics, antifungal. So they also affect or make the fungal infection more resistant, or our body resistant to fungal infection. Anything, any correlation?
So actually, pill popping, just by chemist recommending, is actually a dangerous thing, because some of the antifungals have got side effects, and if this is not noted and taken beyond the duration or beyond the potency levels, then it could cause other systemic problems. That's number one. Number two would be that not all antifungals, oral antifungals, can treat all types of fungal infections. So there are specific types of antifungals that treat specific types of fungal infections. So that would be only determined by the dermatologist, and just by popping the pill does not mean it would resolve the matter.
Right. And that's why doctors are here. They are there to advise us pills, topical application, whatever. But please go and consult the right person. That is the most important thing. We have Neha Chaudhary with us. Her question is, can fungal infection affect both human and animal?
Yes. So some fungal infections can come from your pets, the fur of your pets, cats and dogs mainly. And
Okay.
so the ringworm is something that we see quite often that can come from pets. So if you feel your pet is infected, to get the pet treated adequately, otherwise it could spread onto the owner as well.
Okay. Doctor, those who are diabetic, are they more prone to fungal infection?
Yes, they are more prone to fungal infections and they're more resistant to treatment. More prone to fungal infections because immunity is lower in such individuals, especially if the diabetes is uncontrolled. They pick up infections very easily. And if also their sugar control or the glycemic control is not good, treatment becomes much longer and more difficult.
Okay. And doctor, are there environmental factors that increase the risk of fungal infection, and how can individuals mitigate these risks?
So environmental factors would be like a humid environment, an
Mhm.
environment where you sweat a lot. So that, yes, that could promote fungal infections because of the damp and the wet areas. Then a change of weather, probably from summer to the rainy seasons. The rainy seasons. Also the same thing, the dampness. When it's damp, when it's wet, the chances of picking up an infection is higher. So the key here is to keep yourself clean and to keep those areas dry.
Mhm. Right. And we should always wear ironed clothes
Yes.
clothes that are
Loose cotton
completely dry.
clothing would be advisable. Yes.
Okay. Okay. We have one more question from a viewer that we also have this tendency of applying lots of oil on our scalp in case we have fungal infection, because many a times it itch, it looks like dandruff to a layman. Is applying oil a good idea?
If it's a dry flake, actually it is not a good idea applying the oil, because it further makes the scalp softer, It becomes more difficult for the medications to penetrate into the affected areas. It is best to avoid oiling during the time of active infection. Okay. Once the active infection, the active phase has come down, then oiling of the hair is okay, but not on the scalp.
Okay. One more question from a viewer. If someone is affected with fungal infection and taking treatment, can he or she go to the gym regularly without
Yes.
infecting others?
So you can go to the gym regularly as long as the affected areas are not getting aggravated by your sweating, by the friction of those clothes, because there's workout wear is different from our normal regular clothing.
Right.
Okay, as long as that is not aggravating, it should not be a problem. And the other thing is you should already be on some kind of treatment, proper treatment. Okay. Now, if you've washed your hands, you've kept your nails trimmed, then another individual may not get infected.
Okay. And doctor, before we sum up the whole session, any take-home message, any do's and don'ts for our viewers?
Yeah, for fungal infection, as a prevention and as you can say a prophylactic action, is basically to maintain the hygiene, to keep your clothes dry, to keep yourself dry. Avoid wearing too tight clothing which is too tight for longer period of time. Probably frequent change of stockings. So basically, these things do help maintain a fungal free life. And if you know of someone who is infected, kindly encourage them with love to get themselves treated.
Right. That's really important. Thank you so very much, Dr. Gitanjali Nandini,
Yes.
for your valuable time. It has been a very informative session for our viewers, and it was
Yes,
great
thank you.
hearing you.
Thank you.
And viewers, thank you for your active participation in today's session and stay connected to our channel Radiance with you. Do not forget to subscribe our channel Radiance with you. Thank you. Have a good day. Goodbye.